Hi, my name is Christina Somerville, physical therapist. Today I'm going to talk to you about low back pain and some things to consider if you experience low back pain. So the first thing I would consider is the way you breathe, which I've talked about a lot. Ideally, you take diaphragmatic breaths, which cause you to expand here on the inhale at the lower rib cage, the abdomen, the sides of the waist, the sides of the low back. So ideally, when you inhale, you expand here. And what this does is increases your intra-abdominal pressure, which helps provide support to your lumbar spine. If you breathe up here, there's no expansion, you're not increasing the pressure, you're robbing yourself of that support that intra-abdominal pressure gives you on the diaphragmatic breath. And then another thing the diaphragmatic breath does is when you inhale and expand, you are eccentrically lengthening, eccentrically contracting these muscles in your abdomen, in your low back on the inhale, and concentrically or shortening contraction on the exhale. Again, that's more muscles contracting on your inhale and exhale to provide additional support for your lumbar spine. So if you're breathing up here, those are two big things you're robbing yourself of. So I would definitely self-assess your breathing pattern, practice breathing the right way, and there's a lot of detail that movement professionals can look at with your particular deficiencies, where you're not expanding on breath, which muscles don't appear to be functioning well, and there's really detailed exercises you can get to help with that. But in general, if you practice the diaphragmatic breathing, that's a step in the right direction. Another thing I would consider is the neighbor above your lumbar spine. So here's your lumbar spine, the thoracic spine. This can definitely have a big effect on the way you move and use your lumbar spine. So your thoracic spine, some people get excessive stiffness into this kyphosis, an excessive thoracic kyphosis, and it looks maybe something like this. And some people with the rib cage and thoracic spine are more of a rib thruster with a lot of extension and stiffness in this direction. So if your thoracic spine is not very mobile for you, this can cause you to move too much from your lumbar spine, which can contribute to problems with the function and the way it feels in your lumbar spine. And another thing, the diaphragm connects to the lower 6 ribs. So some of the posturing and positioning and stiffness in our thoracic spine can be coming from the diaphragm. So then that circles back to step 1. Working on your breathing can help with that too, but there's also specific exercises to help with that. The next neighbor to consider below would be your pelvis. So if you hold your pelvis in an anterior pelvic tilt most of the time, that directly affects the posture and positioning of your lumbar spine. It puts you in that excessive lordosis or extension in your low back. And if you are usually in a posterior pelvic tilt, that can flatten out your lumbar spine where you don't have enough of your lordosis. So both of those issues can definitely contribute to the way your back feels. And the way you use your hips, and if you can use your hips separate of your low back, is another big one to consider. So if I'm going to pick up this laundry basket, and instead of having a supported neutral spine with the ability to flex my hips and pick up the laundry basket and stand up, some people get in the habit of rounding or flexing their lumbar spine to pick up the objects. And once in a while, this shouldn't be a big deal, but if this is your strategy all the time to flex at your lumbar spine instead of flexing at your hips, that can definitely contribute to low back pain. And some people are the reverse, where they dump into the low back this way, excessive extension. That would be my tendency. See how good I am at that? So if you're always excessively extending this way, you want to practice contracting your abs more and your glutes more during a motion like this. And the breath can also help with that. So those are just some things to consider that possibly can be contributing if you have low back pain. If you have any questions, let me know.